Thank you very much. In phase 2 studies of sotagliflozin in type 1 diabetes, we saw very positive responses from patients. Very encouraging feedback. They really liked their study drug experience. And as a result, we developed a patient-reported outcome strategy for phase 3 clinical trials. There were two parts to that strategy. One part, which has already been published, was to demonstrate significant improvements in patient-reported outcomes, the Diabetes Treatment Satisfaction Questionnaire and the Diabetes Distress Scale. What you have here today is the other part of the strategy, is to have qualitative interviews. The patient-reported outcomes show if the outcomes improved. What the interviews can show is why they improved in the clinical trial experience with sotagliflozin in type 1 diabetes. So the method here was to interview patients in a blinded fashion by an expert in patient-reported outcomes, a third party, and with random selection of patients without any selection bias. This is key. Patients were selected solely on the basis of randomization data to participate in interviews describing their clinical trial experience. Both the patients and the interviewers were blinded to participation on study drug. 41 patients were interviewed, all in English, mostly from study 309, which is in tandem 1, with a very small amount of patients from the UK and in tandem 2, our European phase 3 study. Another part of the method was that the interviews were conducted in two phases. The first phase was to ask about clinical experiences before the trial, what it was like to live with type 1 diabetes. The other part was to ask about the clinical trial experience itself. The interviews were mostly qualitative, but there were some quantitative questions, two in particular. One was whether or not patients would have chosen to continue on blinded study medication, and another was a satisfaction score on a scale from 0, which is very dissatisfied, to 6, very satisfied. That corresponds to question 1 in the Diabetes Treatment Satisfaction Questionnaire. The results that we had were that the demographics of patients in this interview sub-study, the 41 patients, were very similar to the overall clinical experience. You see that here in Table 1. About half the population was male. The mean age was in the 40s, age of diagnosis in the early 20s, and about a third of patients on placebo, 200 milligrams and 400 milligrams of sotagliflozin. The pre-trial experience, patients most commonly reported they had difficulty controlling their high blood sugar levels, their A1C. They also described significant problems with hypoglycemia before the clinical study. During the clinical study, 80% of patients reported improvement in at least one symptom. What symptoms improved most commonly? A reduction in hyperglycemic events was the most common benefit reported by patients. That was followed by increased blood sugar stability. Then there was a decrease in insulin use, lower A1C, and reductions in hypoglycemia reported by patients. Now, did these improvements have an impact on patient lives? Of the 33 patients out of 41 who reported an improvement, 32 of them described a positive impact on their lives. The positive impacts were most frequently reported as improvements in mood or emotions, 23 out of the 32 patients who had an improvement. Improvements in physical functioning, improvements in self-esteem, and improvements in overall quality of life. Were these symptom improvements meaningful to patients? They were associated not only with improvements in quality of life, but patients specifically rated whether or not they were very important or at least moderately important. You have that in Figure 1. You see these bars in terms of the improvements in symptoms, the high blood sugar, the glycemic stability, reduction in hypoglycemia. You see in the light coloring here, the 1 or 2 patients in each category where the improvements weren't major improvements that were important to them. The solid tall bars here are patients who had improvements that were either very important or extremely important to them. Now, another part of this was the quantitative questions I described, willingness to continue on blinded study therapy. 89% of patients on sotagliflozin said they would have continued on blinded study therapy. Only 43% of patients on placebo said they would have continued that therapy. Now, there are some limitations to a study like this. One limitation is sample size. Only 41 patients out of a program that had hundreds and hundreds of patients. When you have that, it's important to make sure that the patients were representative of the overall population. We saw that in the demographics. We saw that not only in the demographics, but we also saw that in satisfaction scores. The satisfaction score, the other quantitative question, matched very well the DTSQ responses that we had on case report forms in the actual clinical trial itself. Another potential limitation is recall bias. Most patients had discontinued the study for several months before being interviewed. But another way to see if that impacted the results was looking at those satisfaction scores again. Those satisfaction scores overall were within 0.2 points. The mean of the interview questions and the mean on the case report forms, suggesting that patients had excellent recall and accurate recall of their clinical trial experiences. So overall, our conclusion is that patients had a very positive clinical trial experience. The clinical trial experience was primarily driven by an improvement in glycemic control and this concept of glycemic stability. It had a positive impact on patient lives.